That's great. And pressing, ready? Okay, I'm gonna press it now. Going live, guys. Get excited. And let's hope this works. This meeting is being live streamed. Got it. And the dogs have hopefully shut up. Hi, everyone. I think this worked. I'm hoping this is working. It says meeting is now live stream. This is recording. Looks like we've got all the things. Okay. So I am Haley Brown. I'm the Director of Programs and Partnerships for Touch the Black Breast Cancer Alliance. This is our first web series for a conversation about young women. I want to first off, go ahead and thank blackdoctor.org, my mother, Ricky Fairley, Valerie Worthy, even Dr. Mo, who've set the stage up for us and allowed us to come here and do something targeted to young women now. It's very exciting. I'm very thankful for that. And now we can also go around and do a round of introductions. So first, Dr. Candace.
Hello, everyone. Thank you for having me, Haley, and thank you to the organization and Shauna and Cassandra for being here. I am a breast surgeon at Stanford. I'm very passionate about health disparities and educating Black women, especially about breast cancer, because I think it's something that we really need to talk about more in our families and in the community. So I'm just happy to be here and excited to get the word out to everyone.
Awesome. Next, we're going to hear from Shauna. Oh, unmute yourself.
My bad. Hi, everybody. My name is Shauna Wright, and thank you guys so much for having me here. I'm active duty Air Force. I've been in 14 years. I was recently diagnosed with breast cancer. I'm all done with chemo, so I just have my surgery up next. But being a young Black woman myself, diagnosed with breast cancer, I'm so passionate about advocating and health disparities and just getting the word out there that young women can catch this as well, get it as well. So I'm here for whatever you guys need. Thanks for having me.
Thank you. And lastly, I have Cassandra.
Yes, hello everyone. Thank you for having me too, Haley. Cassandra Love. I'm from Montgomery, Alabama. I went to Prairie View A&M University and I got my degree in psychology. I currently live in Austin. And since I've had a close friend my age diagnosed with breast cancer, I've learned a lot, and I know it's very important that everyone knows more information about it. So I'm happy to help.
Yes, so just to give everyone an understanding of why we're here today, Touch the Black Breast Cancer Alliance will be launching a campaign all about young women and preventative breast health come this next January. And so we are kind of just here to start those conversations, and a part of me creating this campaign with my amazing team has been having a board of young women. So Cassandra actually serves on our board, so does Shauna now, for how we test our creative and make sure that everything is going to work with young women. And so thank you guys for also playing a role in creating this campaign. And so so just a quick couple of facts about Black breast cancer and why we're here. So Black breast cancer is a different disease than it is for white women. We have a 41% higher mortality rate and a 39% higher recurrence rate. So it's very different. And then for young women, a lot of the screening regulations and guidelines that we have today don't match the need for Black breast cancer, again, is different for young women. So we are getting breast cancer under 30 at 4 times the rate, and at 35 at twice the rate, and dying at 3 times the rate. So again, it's just a different disease. So today we're going to talk about Black breast cancer and Black breast health and how young women can take a more proactive role now. So just a couple of questions to get us started. What do you guys think that people need to know about Black breast health in general? What are some things that come to mind?
Well, I can go first a little bit. So as you stated, Haley, African Americans are twice more likely to get breast cancer under the age of 35 and 3 times more likely to die from breast cancer under the age of 35. There is research in this area regarding why this is occurring. It is multifactorial from all we know so far. We don't have any biological reasons per se that this is happening. African-American women are more likely to present at a more advanced stage disease, which can contribute to this. There are also social factors and socioeconomic factors that can contribute towards this. And also, as you stated, mammography isn't recommended to start until the age of 40. So it's very important to do self-breast exams, not when you're on your period, or that you're doing it in two different positions. When you're in the shower, most people say, or just sitting up, press against your breast, as well as when you're laying down. If you feel anything abnormal, then definitely tell your doctor so that you can go get screening. The typical screening for a breast lump after the age of 30 would be an ultrasound and a mammogram. If you're under the age of 30, then it would start with an ultrasound. But definitely, if you feel anything, then bring it up to your doctor so that you can get worked up accordingly.
Yeah. So again, yeah, it's just crazy because I think about screening now at age 30 for myself, who has a grandmother who had breast cancer, a mother who had breast cancer, and still I already know it's going to be a struggle for me to advocate for myself to get one just at 30, given my family history. But my mother's have a gene, so it's like, what do people do in that circumstance when you don't have the genetics to back up that you need it, but like you want this ultrasound, not just a mammogram, you know?
Well, most places, as long as you're considered high risk, and it doesn't mean that you just have a gene, if you have a strong family history without having a genetic mutation, you still qualify to have advanced screening. So definitely advocate for that. If you have any issues, then be referred to another doctor who is a breast specialist who can help monitor you.
Mhm.
Yes, and I think the information about those statistics with younger women, Black women specifically, is just very much not well known, and like being younger is not quite something you think about. So I don't know how common the conversation is around Black women. Definitely more common if you have closer family members, but even if it's just someone distant, like you're not thinking about it at a young age necessarily.
That's true.
Yeah. Do you think that young women are talking to their families about health?
Me personally, I can say from my own experience, it was never a conversation in my household. I actually just talked to my mom about this, and she was like, I know we've talked about this before, but the conversation surrounding young Black women and breast cancer is just not common. It just doesn't happen at all. I can't think of one single Black woman under the age of 40 that I've met or even seen on social media until recently that had breast cancer, because I just thought it was 40 and up. Um, and I think if my mom, if she said we talked about it, then we definitely talked about it. I just did not think it could happen to me because historically it's like, okay, 40 and up. You never think it's going to happen to you until it does. So yeah, I don't think the conversation is being had, number one. And if it is, we just need to encourage more young Black women to actually pay attention to those conversations, because breast cancer does not discriminate against age, towards age.
I hadn't thought about the circumstance, but like I had this conversation, but I didn't take it seriously because I was a teenager, and maybe my mom, like maybe we did sit down, but like maybe it could have been, was it memorable, you know?
Right. Again, I think for me personally, I was like, what? I'm young, I'm healthy, I'm a track star. It's not going to happen to me. So I just wasn't paying attention. So I think we just have to figure out a way to like grasp the attention of, young Black women, and, let them know like this can happen to you.
And I think another thing that you all bring out is the fact that it's really important just to talk to your family overall about any sort of health issue, because you can not have a family history of breast cancer, but you have a family history of pancreatic cancer and prostate cancer and all these other cancers that in themselves, they can be something that can help you to look for breast cancer in case you have a certain genetic mutation. So it's really important, especially in the African-American community. I find it extremely difficult, even though I'm a doctor, to talk to my family about like, hey, like what did Aunt so-and-so have? Like, why did she die? And they're like, oh, she had cancer. And it's like, what kind of cancer?
Yeah, I think even in my family, I felt as if we had like an average amount of conversation about, like, I don't think that it stood out to me that we were or weren't talking about health. It stood out to me that our conversation seemed very normal. But then even when my mother was sick, things change, right? It's like you then know, like I knew that she was sick, but just understanding how sick she was a conversation that was hard to have with me at the time, for my family. And so even in situations where you think you are talking about it, like these life circumstances can change and then you might feel differently in that moment. So it's always important to like stick to whatever you believe is right, despite this new cancer or new sickness or new something being added to the equation. What do
Yes,
you
I think,
yeah.
oh, sorry. I think very similarly to you, like it was more of an average conversation, so not something that necessarily really spoke out to me. And I just definitely knowing with different illnesses in my family, it's very important to take care of yourself and advocate for yourself at every point.
Totally. What do you think are the impediments to having these conversations with families? Like, why is it hard in Black families, or why is it hard in any families? But we know that it is harder for a lot of Black families to talk about health. Like, why do you think that is? Or what are the impediments getting in the way?
I think definitely grief can be a big part of it. Like a lot of those hard conversations just comes with a lot of pain. So a lot of people don't get much into it. And of course it varies, but I think that's a big part of it.
That's fair.
I kind of feel like Black families, we associate a lot of things with death, like life insurance. I know a lot of Black families don't have life insurance, or they don't want to talk about, a will, or just different things surrounding death. And it doesn't always lead to death. You just, you need to be prepared and, look out for different signs and just, point yourself in the right direction. So I think just the death conversation is kind of taboo in Black families.
Yeah, like future planning is just like hard in that way. Yeah. What do you think that we can do? Like now that I'm starting this campaign, a lot of you have something to do with it. What do you think that we can do to encourage young Black women to facilitate these conversations moving forward?
I think from one, just definitely getting that information out there again and just like getting that point across that it is drastically different and it very easily can affect you. And knowing that, like, I think it'll open it up, like, this is important. We need to speak about this for us and our future children as well.
Kind of giving them the why, right?
Yeah.
Why is this important to talk about, for sure?
Yeah, I think that education is key. It's not something that's widely advocated anywhere. So I agree.
Yeah, even, oh,
No,
sorry.
go, please.
Even with like a personal experience, like going to the doctor, and I've been to different ones moving around and stuff like that. I've only really remember one that actually told me to check my breasts, I believe like after my period, but that was only a one-time thing in the past few years.
I have a question. Have everyone's OBGYN, have they done breast exams whenever you see them?
Yes.
Okay.
When I've seen them, yeah.
I've never had a breast exam done by my OBGYN.
I find it to be pretty variable. I know I personally went to one recently and she did not do a breast exam. And I was fine with it because I check my breasts all the time. But I think it's unfortunately speaks to the fact that as African American women or minority women, you don't always get exactly what you should get. And it also brings this back to the point that you need to really be your own advocate whenever you're in these sort of situations. I know it's difficult though, because there's a lot of distrust within the African American community with like the medical professionals. One of my best friends and even some of my family members talk to me about how they just don't trust doctors at all, which results in like not going or not even really paying attention when you go. So I think those are all factors that really hinder us, but we really have to try our best to really come informed and say, no, you should be doing these things whenever I see you.
Yeah, you really need like a checklist of everything you need for each individual doctor. You know what I mean? I want to know that like this is where I should go to get this checked, or like, or this doctor can also check this while they're checking that. You know, like they need a checklist for sure. But let's talk more about self-breast exams, because I feel as if I've had this conversation recently where people have said the self-breast exam sounds procedural, sounds clinical, sounds like something that the average person is probably afraid to do, right? And a lot of like it sounds scary, right? And so this and for that reason and many others, we've moved to a place of knowing you're normal, right? And like now it's important to know you're normal. What does that look like? Make sure you be able to notice if there are any changes in your breast. And I then think about my mother's experience, right? And she had triple negative breast cancer, some kind that's disproportionately affecting Black women, young Black women, getting it earlier, at later stages. And now the dogs are wild. Sorry about that. No, but it occurred to me that my mother's kind of breast cancer was so fast growing that had she done this exam monthly, right? Even though it sounds clinical, but it has some routine aspect to it. She may have found something, which she wasn't doing much, like she should have been doing more anyways. But my point is, it seems like the knowing you're normal doesn't have as much of a routine. And breast cancer that moves so quickly, that can grow so quickly in your body from a month to month, it could be nothing, it could be giant, and it could be deadly, you know, in that month to month time. So I'm wondering if that know your normal concept should still have some kind of routine. Oh my goodness, sorry guys. Should still have some kind of like routine aspect to it. You know what I mean? It can't just be, I know my normal. That seems too vague. I think the Black woman needs to know their normal every month. So what are your thoughts on this? What are your thoughts on self-breast exams and knowing your normal?
Well, I'll go first. It's very important to know your normal. I think it's very important, as you stated, to know your baseline and do breast exams regularly, so that if something does change, then you can tell someone. I know it sounds pretty clinical, but it's a lot easier in my perspective than going to the doctor and having them do a breast exam every month. You're in a calm environment. You could do it with some candles lit or whatever you want, but just make sure you understand how your breasts feel at their baseline. And if you feel something that feels abnormal, hardened, mass-like, then definitely tell someone. If you see changes in your nipple, if you see one nipple was pointing outward and now it's pointing inward, then tell someone. If you start to have some sort of discharge from your nipple, then tell someone, so that someone, meaning a medical professional, so that you can get imaging and get everything worked up, and that you can catch things quicker. The other really important thing whenever you're performing these self-breast exams is to feel underneath your arms to see if you feel any masses or lumps there. It should generally be smooth underneath there. So whenever you're doing the breast exams, it's important to check there also. But definitely you should be doing these regularly, just so you know what's going on. Not all breast cancers grow super fast. A lot of them, the most common forms grow slowly. However, we as African American women are more likely to have more aggressive type. You're muted, Haley.
Someone recently also told me to do check around your clavicle as well, that you can find things as high as here.
You can't, yes, that would be pretty advanced if you find something up here. So that's why we normally just say start with
Yeah.
breast, start underneath the arm, both laying down and upright. And then it's easier sometimes if your arm is over your head and you're checking.
Cassandra and Shauna, where are you two with your self-breast exam journey? Are we like, is this something you do routinely? Is it something you want to do routinely? I think this is a safe space to say that if you're like, because I know I should do more. Yeah, I just am at that place in life. So
Yes.
Have never, oh, go ahead, Cassandra.
Oh, you're good. You can go.
Okay, I'm sorry. I have never, ever done a breast exam. I actually found my lump on accident. And it wasn't even doing a breast exam. It was just like putting on my shirt or something. So now I feel like you should do it every 2 weeks, and it should be as common as brushing your teeth or like washing your hair or, something, similar to that. Just making it a part of our, monthly or bi-weekly routine. So that's where I'm at with it now. And again, that's definitely changed since my diagnosis, because prior to that, I've never done a breast exam. I heard about them, but I just didn't think it applied to me, to be honest.
Yes, so with me, I don't do them as often as I should. So I would like to do them more routinely every month or so. I don't think I really knew about it until I did hear about it from that doctor. So it does, like, it's pretty simple. And it's definitely like, it's important to just be in tune with your body because no one will know it better than you. So knowing what's normal definitely makes a lot of sense. And yeah, that way you can track your changes.
yeah, I think so much of the campaign is like, of Touch's new campaign is like, how do we make this approachable for young women? How do I make this part of my brushing teeth routine? I want this to be just like this normal part of my day. Like this is where I go out with my girlfriends on Friday, whatever it is, so thank you guys for sharing. And so thinking about screening, what, and I know we mentioned earlier that mammogram should be before, or the current screening age is 40. So how do we feel about this? How do we feel about this being the age? What can we do to make this, is this something that we can change? Is this why we're so, I think that we have to focus on these self-breast exams and these knowing you're normal because the screening age is so high. And so I'm just thinking, what else can we do to, in this in-between phase of like, I can't yet go get screening, but I'm still at risk? What should the young Black woman be doing?
Well, the main thing to do right now is self-breast exams. If you do have a higher risk due to your family history, then you can get screening sooner. So the other main thing, like we talked about, is just knowing your family history, because then you'll know if your risk is higher.
Yes, and I feel like trusting your gut as well. So if let's say if your family isn't at high risk, but you've been doing your exams and you notice something is wrong, like definitely don't take no for an answer if this is like something you want to move forward with.
Definitely advocating for yourself during your appointment, and like Cassandra said, just not taking no for an answer. I tell my friends, like, if you feel something and they tell you no, just go in there hollering until you get your mammogram, because it could save your life.
On that note, I do want to talk about navigating the healthcare system? How do we empower young Black women to feel comfortable walking to a doctor's office and screaming from the rooftop or whatever it is? I think back to this one scene from Terms of Endearment. My mom and I love this movie when she's like, yeah, the mom is yelling at the doctor to just like give her daughter the shot. And it's just this such a vivid scene because not all people feel comfortable doing or saying that, or just like advocating for themselves in space or advocating for others in the space. I would even say it's maybe easier to advocate for your child than it is for yourself. And so how do we empower young Black women to walk into the healthcare space and like this dog, like she feels empowered. But no, how do we empower the young Black woman to feel comfortable advocating for themselves and even give them the right tools to do so?
I think it all starts with education, knowing what you deserve when you walk into a medical space, knowing what the standards of care are, understanding that there are patient advocates at most healthcare facilities who you can contact if you don't have anyone who you think would be helpful. You're allowed to bring family members or friends in, or even like call them sometimes if you think that you have a certain friend who can be a patient advocate. I volunteered for multiple of my family members and friends to just be that advocate for when they go to the doctor's office. So I think, but the main thing would be education and knowing that just because someone says no to something, like if you feel a lump and they're like, oh, it's probably nothing, they need to be sure that it's nothing. They need to perform an ultrasound, and if you're over 30, do a mammogram, so that they can be 100% sure that that lump is nothing. So know what should be done in those situations, and that's a little bit difficult, especially if you don't have a medical background, which is why I would say try to have a patient advocate with you if you feel like you're not getting this type of care that you should be getting, or have a family member who can help advocate for you.
And that's so crucial too, just because you might be, depending on what you're dealing with, you could just be in shock about what someone's saying to you and need to like just someone to remind you that where you are. And so I think that having that extra person there is crucial, whether it's someone in your family that you trust or a nurse navigator, someone in that capacity.
Yes, I think the support is super necessary, and I didn't know about the patient advocate, so that's really great. Definitely just accesses to resources like that and knowing that's available. And even I think like having resources for like more Black doctors would be great. And yeah.
Also, like at the bottom of most like healthcare pages, it says contact us. If you're having issues, really contact them and get, a lot of times they'll have emails on there and phone numbers and different things. I know there was one point where I'm sure I was just freaking out, but I felt like they weren't moving fast enough for me in my situation. And I started emailing, a few higher up people, and things got moving a lot faster. And I'm sure at the time I could have just been freaking out, but you never know, especially with the disparities towards minorities in the healthcare system. I didn't want to take that chance. So it says contact us at the bottom, really contact them. That's what it's there for.
Wait, Shauna, I'd love to hear more about your story. I know you and I have talked offline a little bit, but I'd love to hear more about especially navigating in your situation with the military.
Right. Okay, of course. Thankfully for me, my doctor, she took it serious. I really thought I had just pulled a muscle.
I guess we can even start with like, what kind of cancer did you
Right.
have? Like where, yeah, tell us all.
Yeah.
Like,
Okay, sure. So this is like back in May. I had just finished Orange Theory and I was getting ready to take a shower and I felt a lump. And I was like, oh, I must have just pulled something. I really didn't think nothing about it, but I work really hard for my health insurance. So anytime there's anything wrong with me, a sneeze, a cough, a cut, I'm going straight to the doctor. So I made a doctor's appointment. I got seen that Monday by my PCM, and she was like, let's just get it checked out. It took a month for I had to get a referral. So it took a month for me to even get seen, which was frustrating, in itself, because your mind is just like going a million miles an hour during that month. So I go get seen. That whole experience was traumatic and terrible in itself. And there's no real nice way to break it to somebody that they have breast cancer, but a little bedside manner can go a long way, right? Especially after waiting an entire month. So the doctor says, "Oh, I don't know what else it is," and I'm just sitting there in shock. That's like Dr. Thompson said, "Take somebody with you." Take somebody with you in these situations, even if it isn't nothing. I wish I would have had somebody with me that day. I had to go drive and pick up my daughter, and it was hot, and the AC in the car wasn't working, and I had just been dropped with like this information, and it was just terrible. And the next step was for me to get a biopsy, and I was like, man, I waited an entire month just to get seen here. Now I'm probably gonna have to wait a few more weeks to get my biopsy. It's just scary. It was just a scary situation. um so I Yes, ma'am.
So did you have to wait a month to get imaging, like a
Yes.
ultrasound?
Yes, I had to wait a month. Yes,
Okay.
ma'am. Yeah. And again, that was frustrating. And I was this close to going my insurance company about it, because if you guys don't have the I understand the healthcare system, it's stressed and undermanned and overwhelmed. But if you guys don't have the manning to take care of your military, then you need to send us elsewhere to somebody, that does. Um, so, and I found out about all this on a Thursday. So Friday, I don't hear nothing. I have to go into the long weekend, and I even feel like, communication is everything. So even had it been hey, Shauna, we know you're worried, we know you're concerned. It's going to be a long weekend, because I think it was like Memorial Day weekend. You may not hear from us, but don't worry. We're going to get back to you on Tuesday, or just something. I didn't hear anything, and I went to contact us, and I got the name of, it was like the vice president, the director. It was like 4 or 5 people. And I shot them. It was a very nice email, but just basically advocating for myself, that I've already waited a month. Now you guys want me to wait some more time? Like, I need help and I want it now, basically. And they took care of me. So long story short, I have stage 2 breast cancer. It's HER2, it has the HER2 protein, and estrogen as well. So I've just finished my 6th round of chemo. Everything went really well with that, and I'll be getting surgery here in about 3 weeks. And yeah, it's definitely been an experience, but it taught me to advocate for myself, advocate for others. That's why I'm here. You don't hear about a lot of young Black women getting breast cancer. You just feel like, again, I was insulted when it happened to me. I was like, are you kidding me? Like, I'm a track star, I'm healthy, I'm this and that, but it does not discriminate. So I love this platform to be able to get the word out there, because I think when you see somebody who looks like you or who's your age, I know a lot of my friends now, they're like, let me go get a mammogram, or let me do my self exam, or it runs in my family. Let me, keep an eye on it. Like, all of that is a win for me. And I'm just glad that them seeing my stories and inspiring others to do these self checks and advocate for themselves and stuff like that. So sorry, that was a long version.
No, thank you for sharing your story. That was really helpful. I'm sorry you went through all of that, but that was a great example of really advocating for yourself. Unfortunately, you had to do that
Right, right,
for so
right,
long. But
right.
congratulations on being done with chemo.
Thank
And
you. Thank God. Thank you. Yeah, um it was challenging, but I got through it. And I think another thing is, when people hear cancer, I know when the doctor told me, I'm like, oh my God, I'm not gonna be able to take care of my daughter. I'm not gonna be able to go to work, and I'm not be able to do this, this, and this. And I think it's a lot easier for, when women feel the lump, just to ignore it because they want to keep going about their lives. And, a lot of people, they don't have the time off to take during treatments, or they don't have family to like help out and stuff. But I'm here as a testimony. I was still able to mommy. I was still able to go to work. I was still able to work out. I was still able to do everything that I was doing before. Now it wasn't at 100%. It was at 75, but it still got done. And praise God, I was still able to get my treatment. So the sooner you start your treatment, the better it is. The better your prognosis and the outcome is. So I think that's another thing. Just don't put it off. I think a lot of Black families, it's like, oh, I'll deal with it later. Oh, I'll just eat some greens or juice and and make it go away. No, God put doctors here for a reason, and medicine has come such a long way. Not everything is a Tyler Perry movie where you're just laid out. It's things are different now.
No, thank you for sharing. It's just it's so nice to see that somebody was able to, feel empowered enough to advocate for themselves. So thank you for that. Thank you for continuing to do all the things that you do. But it's like, yeah, you can't stop your life. But I think the thing about doing self-breast exams and knowing her story and talking to our families, all the things that this campaign is about and what we want young women to do, is because like breast cancer doesn't have to be deadly. It doesn't have to be this thing that you die from if it's caught early, or if you have a great doctor and a great treatment placement plan. And so, yeah, I think it's so important that we do all the steps that we can to make sure we're in the best predicament if it were to happen.
Right.
But yeah, and Cassandra, I don't know if you wanted to share anything about your experience with you being such a close friend to somebody who had breast cancer. Obviously, her good friend is a huge part of Touch also. And I'm so happy to have now met you and seen how close you guys are, because it's been so great for her to, we're speaking of, I'll let Cassandra tell the story, but yeah, go ahead. Why don't you share a little bit about her? And
Yeah, so Ariana, I believe she was first diagnosed at like 19, right before her 20th birthday. And I definitely remember just like her questioning my friend's mom about it, like, is this something I should get checked out? And she did, and she found out right around her birthday. And definitely like that situation being close to me, and I feel like I've never really was close to someone that had cancer. So it was just very different and crazy that like she was so young and she got it. And then getting it a second time as well, like it was a lot. And she went through a lot doing that and being in school doing that, and just seeing how she was able to just hold her head up during both times was very inspiring, very amazing. Like I've never seen nothing like that. So her actually like treating the cancer patients while she's getting treatment and graduating with her degree in radiation therapy. So now she still actively treats them. It's super awesome, and I'm very happy for her now. But it's definitely, it's very crazy to see up close and to know it can happen to anyone.
yeah, she's an amazing person too, who like took it by stride. I wasn't there. I didn't know her during that part of her journey, but even now, knowing how strong she is, it's been so nice. But again, she's a huge testament to like breast cancer does happen early. It just does. And we have to be ready for it. But it's also really important that we have people in our lives who can be caretakers and be there as support, like so many of us have said today. So thank you guys for all playing a different part in someone's journey or your own journey. I think it's very important. And I did want to talk a little bit today about, because obviously these are large issues. We're not going to solve them today, but we can get everyone a step and further in the right direction. So I want to quickly think about how young Black women have been affected by COVID in terms of healthcare in the last couple of years. I think that for me, at least, and for so many of us, we probably stopped going to the doctor as we would have, or like there became this lapse of care towards our own bodies. And so I wanted to open the floor, like, what do you think COVID has done to how's it affected us in terms of going to the doctor and making sure we're taking all the right steps we should?
Well, I mean, studies have shown that as a whole, all across the world, people have definitely fallen behind on going to the doctor, especially in the area of like breast health and breast care and getting diagnosed with breast cancer at later stages as a result of COVID. I think things are getting better now. People are feeling more comfortable to going to medical offices, but it's definitely caused some patients to present at later stages.
Yes, and I think because of COVID, like just the healthcare system, it's been difficult in general. So at least in my experience, I know it's been very hard to get certain appointments and like they're booked out in months. So that can definitely be like a deterrent to like the normal routine that we kind of got broken up and just falling into that.
Yeah, that's very true. And in those situations, I would recommend if it's like your first time seeing a certain doctor, maybe calling in and seeing if they had like any cancellations, if you have earlier availability, or sometimes calling around. Unfortunately, I personally had to do that just to find certain doctors to go to.
Okay.
Yeah, I know for me, it's been, I should go to, there are certain things that I should have done during COVID that I didn't. And but now I think we're on the mend. People are out there going back to doctors. I think it's just a matter of making those appointments. So yeah, so just to like feel like we kind of got our feet wet in terms of like talking about young women on this space. And I want to again thank blackdoctor.org for allowing us that space. So I think overall, what advice should we be giving young Black women right now? If you had any, 1 to 2 takeaways for the young Black women to, if they were listening, hopefully you are, to leave this space and think that they could make a difference in their lives tomorrow, right? What are some actionable things that we can all do?
Definitely.
Go ahead, Cassandra. I think we're going to say the same thing.
Yeah, so definitely just sharing that we get it 4 times the rate as white women under 30. I think that's absolutely crazy, and that you need to do your breast exams consistently.
And breast cancer is not, sorry, Dr. Thompson.
No, you can go.
Breast cancer is not a death sentence. So if you find something, it's better to go get it checked out than wait. Early detection does save life. And if they do find something, technology, medicine has come such a long way, and your chances of survival are really good now. So the sooner you get seen, the sooner you can get treated.
Yeah. Breast cancer is not a death sentence, but presenting at a later stage is definitely more difficult to overcome than if you perform your monthly breast exams and you find something and you get it worked up and you get it treated early. So definitely do your self-breast exams, talk with your family and know your history so that you can know whether or not you're high risk and if you need to get more screening early on.
Yeah, it seems the theme here is to like be in the know, be knowledgeable about everything you can be knowledgeable about things you don't know, so you can bring somebody or have somebody there to help you advocate. Obviously check, know your her story. That's what we call it here. Yeah, talk to your families about it and understand if there's anything genetic, get genetic testing if you haven't. We work with a lot of different things, and hopefully once this campaign launches, you'll have a lot of access to different people who have already done some of this work, and we can Make sure we're not reinventing the wheel here because so much has been done for preventive breast health. We just need to make sure we're doing it now, I think. So yeah, check your breasts, talk to your moms, all of that good stuff. Any other like last minute thoughts or questions or things you guys might be thinking about you wanted to talk about here?
One other thing I do want to bring up is that about 30% of breast cancers are attributed to modifiable risk factors, which means there are certain things you can do in your daily lifestyle to just try to help decrease your risk. It doesn't mean that these are end all be alls, but things like watching your weight, making sure you don't have excess weight, making sure you get your daily dose of exercise, and limiting your alcohol intake.
Yeah, I mean, there are so many things that I think we could do daily to like
I know.
help our lives. But that it's important to know. I mean, I've learned so much in just being in the breast cancer space myself that like hair products and the hair products is a big one.
Yeah.
And the things we just like put on our bodies, not drinking enough water, all of these things could lead to huge differences. Yeah, we should all commit to taking away one thing we're going to do daily to add to a better life.
Just try to stay healthy.
Yeah, yeah.
Healthy lifestyle.
Right.
Well, this has been great, guys. I want to really thank you all for showing up on this Sunday. I know that Sundays are a day of rest for so many of us, so thank you for taking this time. I want to especially thank Dr. Candace. I cannot wait to do more of these with you. Hopefully we can continue this new thing with young women. And Cassandra and Shauna, thank you so much for sharing your stories and your advice. And yeah, I just can't thank you guys enough for being here today with me. And thank you to obviously, huge shout out to Ricky Fairley, my mom. She hooked all of this up. Thank you to blackdoctor.org. And I can't wait to do more of these. So hope to see Black breast health and more topics in the future, and Touch's new women's campaign launching in January. So thank you guys. And I hope you guys have a great Sunday.
Awesome. Thank you, Haley.
Thank you.
Take care.
I would end this if I knew how.
Should we just log out?
Let me see if we're still on.